Here we're looking at Lefort fractures. These are mid-face fractures, and there are three categories of Lefort fractures, and collectively these constitute about 20% of skull fractures overall, and these are due to crush-type injuries to the anterior skull. So we see Lefort 1. Here we see Lefort 2, and then to our far right, we have Lefort 3. If we look at these individually, we'll begin with type 1. You can see where the red line is, and this would represent the line of fracture in the midface. Some considerations here to keep in mind is that this fracture does lie superior to the maxillary alveolar processes. This would be where the maxillary teeth are found in the maxilla itself. So we're looking at structures that would then span the nasal septum as you come across here, across the midface. And then this type of Lefort fracture may also involve the pterygoid plates that are features of the sphenoid bone. Type 2 Lefort fractures occur along the fracture line here, shown in red. Structures that are along this fracture line would include the posterolateral parts of the maxillary sinuses that would lie within this area here and over on the opposite side. The infraorbital foramina are in this area of fracturing. And lastly, the lacrimal or ethmoid bones may be fractured along the fracture line of a type 2. The third and final type of Lefort fracture is simply identified as type 3. This lies most superiorly with respect to the other two types, as we can see the fracture line coming across here. Horizontal fracture, upper midface, passes through, kind of hard to detect here, but will pass through the superior orbital fissures. Involves the ethmoid and nasal bones. Hard to see the ethmoid involvement in this view, but you can see involvement of the nasal bones. Would involve the greater wings of the sphenoid bone. And then lastly, which we can appreciate, it would involve the frontozygomatic suture. So that suture lies right in through here on this side and right in through the opposite side.